Tēnā koutou katoa. Tūtahira ngā whakarongo ki rātou ngā tini mate o te wā. Rātou kua whetūrangi chia I ngā wiki, ngā marama, I ngā taupu hipa. Ahara mai haere. Ki tika anō kia tātou, ngā waihotanga o rātou mā kua wehe atu rā. Tēnā koutou katoa. Ngā me atu kia koutou e mātaki maina. Hako ko wai, hako no hea. Nei, e mihi atu ana kia koutou katoa. Tēnā koutou, ko Boyd tēnei. Boyd Broughton, the Director of Health for Te Hā Oranga I Te Runanga o Ngāti Whātua. I'm here to give the health update in the hauora Health and Social Services arm of the Runanga, Te Hā Oranga. Sadly, I'm a bit longer than the other updates that have been uploaded. So sit down and get ready for a long chat. We've done a bit. I'll start off with who we are in case you don't know. So we're Te Hā Oranga. Been around for about 28 years, I believe. We're the hauora Health and Social Services provider for Te Runanga o Ngāti Whātua. We operate from 5 different locations: Tāmaki, Te Awaroa, Helensville, Wellsford, Dargaville, and Whangarei. And from those locations, we've got 8 sites, well, 7 sites. We're about to open up our 8th early next year. We offer a range of services. We've got, and I'll speak more on these, we've got over 1,600 registered whānau that we work with. There's over 140 staff working for us, and there's a number of positions in there and services that we offer. And about 80% of our workforce are Māori. And some of the outcomes that we deliver also include our support, financial support that we contribute to the Runanga last year, transporting whānau to marae for either hui mate or tangihanga. And also standing up other wānanga, such as wānanga for hapu mama, wānanga for financial literacy, and other kaupapa throughout the year. So I'll talk about 2021 to 2022. The last year has been a real tough year, again, for the organisation, for the country. One of the sort of gains, or one of the objectives that we've had from last year, was to have greater representation on several on advisories and on governance, giving expert advice across the sector, and we've achieved that. And one of the things of note, though, I won't go through all of the boards and advisories that we are part of, but one of the key points we advocate for when we have those opportunities is Māori as a priority, and the equity of access and the equity of outcomes for Māori, and to reassert and acknowledge the political authority that was taken away from Ngāti Whātua, and that we would like reinstated, and to reinstate those old systems. We're real fortunate last year, or this past year, to have the opportunity for myself as General Manager to be seconded to the Ministry, which later became Te Whatuora, as part of the National Immunisation Programme Equity Team, as a Regional Account Manager. I learned lots, and we learned lots as a result about what works and what doesn't within that institution and those other institutions. And during that time, we had an interim general manager put in place to uphold the management of Te Hā Oranga. Now, we've also progressed a senior advisor contract with the Department of Corrections, which will see us in the ideal position of managing a transitional housing project in Tāmaki Mākaurau within the next year. We hope to get that up and running. And whilst we continue to progress with them, a memorandum of understanding, and that memorandum demands greater outcomes for Māori within the rohe of Ngāti Whātua and Aotearoa in general, and so greater accountability on how the Department of Corrections interacts with our whānau, and when and how. We had mentioned the care facility we'd like to stand up in Dargaville. Due to COVID restrictions, the progress on that has been stalled, and while this remains a work in progress, we also will have a review of what we mean by care facility, and is a better term for it, whare hauora or whare ora, as a centre for wellness and the prevention of illness. And so that's a little bit of water to go under the bridge for that. We've commenced to focus on our workforce development. Our workforce have been the backbone, the legs, the arms, the face, the feet, the eyes, the ears of our response across the country. the Māori workforce has been there for the response to COVID-19. We also want to build a sustainable and long-term contracting agreements for our workforce. There's a lot of work to be done on our workforce to recognise the hard mahi they've done, the risks they put themselves and their family, their whānau by being a part of the response. On top of that, we also want to strengthen their kōrero, their information and knowledge of the kōrero tūpuna hitori or Ngāti Whātua for the different parts of the rohe we work in, and to base our care on the tikanga of Ngāti Whātua specific. How do you do just kaupapa Māori, but kaupapa Ngāti Whātua? So we've got a lot of learning and a lot of wānanga to be had. There's been a lot of planning continued as Te Hā we've added some infrastructure to support the quality delivery of hauora services to whānau in the community, including increased leadership capacity as funding allowed and when the need increased. And as I said, we've purposefully evolved into supporting whānau solutions with the many determinants of health, the social, cultural, economic, and commercial determinants of health, which include housing, employment, education, racism and health. And this is an ongoing kaupapa for us as we move into those different areas. We've also seen a continued growth in staff, services, and as I said before, infrastructure. And one of the important gains was that the social services support and FTE available in Te Hā grew with a newly formed mental health service in Dargaville, which I'll talk a little bit more on how long overdue that was. And that growth also extends to both the growth of individuals, which has led to the departure of one of the longest serving staff members, the well-known community nurse Naomi Walker, who resigned and commenced work for Whakarongoto, and this mahi allows her to work from home, spend more time with her beautiful young family and tending to her horses that she used to send photos of. And our staff and our whānau and the community, she devoted her time, effort and love to. We're all invited to share what was an emotional farewell at Te Paunga Marae, where Naomi's long service to the whānau community were acknowledged, and we all wished her and her beautiful whānau well. And one of the most important growth plans for Te Hā Oranga has occurred with the birth of 3 more babies into the Te Hā whānau, and with another 2, one already born and one due in 2023, I believe, in acknowledgement and recognition that healthy and well-resourced hapu mama remain the ultimate determining of well-being for our future generations. We had one exciting year. We had the health reforms. Hauora on the 1st of July saw the transition to Te Hā, which is the Māori Health Authority, and Te Whatuora, which is the Health New Zealand. Te Hā Oranga, we've had many health contracts that were previously spread across 3 different district health boards. That was Northland, Waitemata, and Auckland. They'll now be transitioned over to one entity, Te Hā. We've also taken several opportunities to provide some leadership and or support to the formation and facilitation of the Iwi Māori Partnership Board and the localities for Tāmaki and Te Taitokero, which will be part of those discussions ongoing. We continue to advocate, as I said, for long-term, evergreen and integrated contracting from those entities to enable us to entrench our service in the communities that we serve and present and build relationships and build trust and present a well-known face for our whānau to access their health services through. A little bit of talk about Te Raro Street and the expansion in Dargaville. So we've acquired a property in 2022 after many long years and some significant growth in the services in Dargaville, where it all started, primarily as a mobile health service. And so we've now built up and we've got our first ever mental health contract in Dargaville, long overdue. And Te Hā Oranga were able to purchase a second property, which is currently under renovation, will be opened in early 2023. And that will be for services to be delivered to whānau in the community and also house our staff, our growing numbers of staff there. I touched on a little bit earlier about the registered whānau. We've got about 1,600, just over 1,600 registered whānau. With this past year, we've provided care in the community to thousands during the Oranga tonu part of our response to COVID. And that care was administered to registered and unregistered whānau. While there has been a small increase in our registered whānau, there's been no increase in the funding or FT allocation for that service from the Northland DHB to Whatuora to Taitokera in Dargaville for our nursing contracts. And this has become problematic and is a barrier for our whānau accessing healthcare, as we're unable to register any more clients, and rightly so. This causes big upset from the whānau and community. And we've been continuously working on solutions with our current resources. It's a real delicate balancing act to ensure we don't deregister whānau who may have high needs in order to take on new registrations. So it's making sure we manage our registered clients well, and for the ultimate outcome being a well and healthy community. And just a bit of a note there that nationally over 200,000 more people registered with health services over the last 2 years, which has put immense pressure on all providers across the country. And that was largely to do with the huge drive around vaccinations and re-engaging our whānau who had previously been disengaged with the health service. So it's a nationwide pressure that we're feeling, and we know that doesn't bring comfort to our whānau in Dargaville, but please, we are trying our very best to manage that appropriately. We've also developed some infrastructure now to offer mobile health services with 2 mobile units, one in Dargaville and one in Wellsford. And there is access to a third if required, which was acquired by the Runanga for the COVID border control in those early days of stopping Aucklanders, or trying to stop Aucklanders transmit the virus into Taitokera. So we are a mobile health service, all our health services. And our staff have been resourced to work remotely in order to support our mobile health services. And one of the really important things that we've been able to do is to reinvest. So on top of the services that are provided and the care that we're able to offer through those contracts and through those kaimai, we've been able to invest over $1 million directly into our whānau and communities within Ngāti Whātua. It's via significant whānau water support, significant Ministry of Social Development, community support, Te Kapua Taonui, our iwi chairs into Taitokera, Te Puni Kōkiri, and others. So we've been able to deliver kai, water, warmth, some housing repairs where required and urgent, marae grants and marae training schemes, which we're able to offer, to include just normal wānanga, as I spoke about, but also financial literacy and other COVID support that we've been able to get resource into the houses, into the marae, into the pockets of our people. And on top of that, we've also managed to reinvest over $1 million into Te Runanga o Ngāti Whātua. I've been going on for a while, and this is a long presentation, so if you'd like to take your time, press pause now, go and have a cup of tea, a cup of water, maybe a sandwich, and I'll start again. You can press pause and start the second part of the kōrero. Welcome back to those that went and had a cup of tea, and kia ora anō to those who didn't and just watching straight through. As I said at the start, a bit of a long kōrero here. 2021 to 2022, COVID-19 remained at large in the community, and with Tāmaki, especially last year, experiencing the longest periods at the most restricted alert levels or at the highest traffic light settings, and that's for the tail end of 2021 and into the puku of 2022. With our services being mobilised and staff equipped to work remotely, these high restrictions still had an impact on outcomes for whānau, especially around mental health and those who struggled financially. And most of the possible disconnection was avoided due to our mobilisation of the workforce. We still offered clinical support and vaccinations, and with over 6,000 vaccinations, over 20,000 rapid antigen tests distributed across the region, and we shifted our focus from the vaccination clinics to whānau days, which have the Pfizer and other vaccinations and immunisations available to all eligible whānau. Also to that end, we had some collective work efforts with a whole lot of partners around the rohe, but one of the most important ones was the Te Hā to run the first marae-based COVID testing pilot, which started in December 2021, which for the period to June 2022 remains self-funded by Te Hā Oranga, with funding only just being received in November this month for that kaupapa. So a massive thank you to Te Hā and Auntie Margie's massive leadership and the huge work she's done to try and limit the spread of the virus and keep the whānau and community safe out there. Care in the community, we continue to support over 3,200 whānau across the rohe, Ngāti Whātua who were isolating at home, either with COVID or as a close contact when that was required. All those whānau who were in need due to the restrictions or general hardships and cost of living crisis, which is being felt and experienced nationally and globally. Very privileged to start what was called the Taitokero Western Hub. So in response to COVID-19, Te Taitokero established 4 hubs to facilitate care in the community across the rohe. In Te Hā Oranga and Te Roroa provided collective leadership for the Kaipara Dāgawal and West Coast rohe. In Tāmaki, Te Hā Oranga, Ngāti Whātua had a call centre. Te Hā established a call centre with whakarongoro with 2 key aims from our perspective. One, to provide support to whānau who had questions about the vaccination, who had tested positive, and who were in isolation or anything to do with COVID-19. And the second aim was to provide employment opportunities to whānau, to upskill those whānau during an international pandemic, and to resource those whānau with the IT that was invested into them. IT that those whānau are allowed to keep happening and able to keep, which, as we know, if we invest IT into one member of the whānau of the household, that investment supports the entire house. So we're very honoured to be able to offer that. And towards the end of 2021, we made the decision to shift our call centre resources from the whakarongoro main lines to exclusively supporting Māori, the Māori Response Coordination Hub in Tāmaki, which focused our support on high needs whānau Māori in Tāmaki who tested positive and were isolated with COVID. Admit whakarongoro didn't agree at the start, but we asserted that was what our desire to look after Māori in Tāmaki. From that, we answered over and responded to over 6,000 calls from whānau, and they were supported by the call centre for that period. And this number, while it was focused on Māori, that grew to include non-Māori whānau as the numbers of cases decreased across the region. One of the bragging stuff we've also got a public health team that had a couple of really good highlights I'd like to talk about. One of them was a submission. So they did about 18, I think it might have been 20 submissions over the 12-month period that we're reporting from on various kaupapa, and took the opportunity to support whānau and communities to facilitate their participation in the submission process, which helps to grow the social advocacy capability across the rohe, across the whānau and across the community. Those submissions were submitted on a range of health and public health kaupapa, such as the sale and supply of alcohol, proposals against incitement of hatred and discrimination, and the submission of the hauora bill along with others. So a lot of work went into those submissions and again to building that social advocacy capability. But one of the absolute highlights of the year for our public health team was, after being postponed from January 2022, we had planned a face-to-face national Māori health promotion hui. One was hosted and facilitated online by Te Hā Oranga and other partners, including Hāpai Te Hauora. There were some esteemed speakers such as the Honourable Minister Piri Henare, Tā Mason Jury, and the interim CEO of the Māori Health Authority, Liana Manuel, and others. The kaupapa of this kōrero was to build the capabilities and capacities of the Māori health and health promotion workforce in kaupapa Māori and mātauranga Māori, and to do that by bringing the workforce to hui to network, collaborate, and share cutting-edge mātauranga that is required for the upcoming or for the current health system reforms. And this included rongoā, the maramataka, raranga harakehe, kapahaka, the arts, language revitalisation, te reo Māori, play, and the very definition of kaupapa Māori from Professor Koka Linda Smith, among other kaupapa, and not a needle, and not a jab, and not a pill, to be seen as the single solution for our whānau and their hauora and well-being. So that's just a couple of highlights. Te ara whetū Māori Health Promotion, hui hikoia te whetū, hikoia te marama. As you can see, we've got Dr. Ruaki on who spoke about the whakarawara with Te Reo Māori, so revitalisation of Te Reo Māori. For 2023, Te Hā Oranga will continue to monitor overseas and national, international experiences in health, including current COVID-19 data and support for Indigenous populations across the world. We're also going to have a look at Ngāti Whātua to make sure that our kaupapa are locally led, but are regionally, nationally, and internationally informed as appropriate and when appropriate. The thing I spoke about earlier, we'd like to continue to assert the political authority of Ngāti Whātua and progress a focus on the social, economic, cultural, commercial and spiritual determinants of health, commencing or continuing the installation of a Ngāti Whātua specific hauora system grounded in Ngāti Whātua mātauranga, pūrākau and hitori, and utilising ancestral lands, natural resources, tribal knowledge, whakapapa and whenua for the safekeeping and safety and sustenance of our people in a sustainable fashion. A lot of S's in that one. We also want to look at reinstating, essentially it's looking at reinstating much of the old, cognizant of the new, the contemporary settings, the contemporary access challenges and enablers, the capacity, capability, and also the technology that we have available to get our health services to our whānau and our people. As I said, growing into greater implementation of tikanga Ngāti Whātua within our services while carefully remaining mindful. One of the things I always challenge our staff is to remember that we cannot be everything to everyone all the time. When we are resourced, when we are trained, when we are skilled and funded well, we can get bloody close. We've also had a strategic review commence in July 2022, Te Oranga 2.0. We're excited to provide updates as the year progresses and again at the AGM for 2023. Hoi no, ko nawhi tēnei. Mā koe mihi ana kia koutou, mai a mātou o te Hā Oranga o te runanga o Ngāti Whātua, no mātou ki te whiwhi, no mātou no te honore, kia mahi ai nei mahi o kōrero hia nei e au, hei painga mo te iwi, no reira tēnā koutou katoa.